Sure.
Okay, great. Thank you. Good morning. My name is Ondina Love, and I am the CEO of the Canadian Dental Hygienists Association, and I also serve as co chair of HEAL, an organization representing 650,000 healthcare providers. I'm joined here today with colleagues from optometry, psychology, speech language and audiology, occupational therapy, and dentistry. Canadians are very proud of our publicly funded healthcare system. However, many healthcare providers work outside of the publicly funded system, yet play an invaluable role in the prevention and treatment of patients. Access to care to this group of key professionals is utilized by 75% of Canadians through employer sponsored health and dental benefit programs. These plans provide preventative care, prescription drugs, mental health services, dental care, musculoskeletal care, and more. In fact, without the health care covered by these benefits, Canadians will enter the public system with greater health needs, driving up costs even further. The federal government is currently considering taxation of the premiums on employer sponsored health benefits. They calculate this foregone tax revenue at $2.9 billion per year. But this number doesn't tell the whole story. This $2.9 billion incents more than $32.2 billion in healthcare being delivered to Canadians. Taxation of these benefits will have huge impacts on access to care. When benefits were subject to provincial income tax in Quebec in 1993, almost 20% of employers dropped their coverage, including up to 50% of small employers. This loss of coverage can significantly impact the lowest paid employees, who will have trouble paying for drugs, dental, and needed healthcare out of pocket. In addition, younger and healthier Canadians may opt to drop benefits, which would destabilize the benefits market and increase the existing cost of benefits. Also, what would happen to patients with pre-existing conditions? The current public policy approach is working as intended. 24 million Canadians have care through these benefits. The health professions standing here today are concerned about access to care for Canadians. Taking care away from millions of Canadians is certainly not the way to address fairness and equity. Ultimately, this does not simplify the current tax code nor bring more fairness to Canadians. It will download complexity onto employers and leave many without the care that they need. Thank you.
Bonjour, je m'appelle Laurie Clément, je suis la chef de la direction de l'Association canadienne des optométristes et membre du groupe d'intervention Action Santé, une organisation représentant 650 000 professionnels de la santé. Je suis accompagnée aujourd'hui par mes collègues hygiénistes dentaires, psychologues, orthophonistes, audiologistes, ergothérapeutes et dentistes. Les Canadiens sont très fiers de leur système public de soins de santé. Toutefois, de nombreux fournisseurs de soins de santé travaillent en dehors du système public, mais jouent un rôle indispensable dans la prévention et dans le traitement des patients. 75% des Canadiens, dont 24 millions de Canadiens, ont accès aux soins prodigués par ce groupe clé de professionnels de la santé, par l'entremise de régimes d'assurance santé et soins dentaires offerts par l'employeur. Ces régimes leur permettent d'obtenir des soins préventifs, des soins oculovisuels, des médicaments d'ordonnance, des services de santé mentale, des soins dentaires, des soins musculo-squelettiques et bien plus encore. En fait, sans les soins de santé couverts par ces avantages, les Canadiens auront de plus grands besoins en matière de santé au moment d'entrer dans le système public, ce qui fera grimper les coûts encore davantage. Le gouvernement fédéral considère l'imposition de primes liées aux avantages. Il estime que ces recettes fiscales cédées s'élèvent à 2,9 milliards de dollars par année. Mais ce chiffre ne raconte pas tout. Cette somme de 2,9 milliards de dollars se traduit par plus de 32,2 milliards de dollars en soins de santé prodigués aux Canadiens. L'imposition de ces avantages aura de lourdes répercussions sur l'accès aux soins. Lorsque le gouvernement du Québec a assujetti des avantages à l'impôt provincial sur le revenu en 1993, près de 20 des employeurs ont abandonné la couverture. Ce pourcentage s'élevant juste à 50 chez les petits employeurs. La perte de couverture risque d'avoir une incidence considérable sur les employés les moins rémunérés, qui auront de la difficulté à payer ces services de leurs proches. De plus, les Canadiens jeunes et en santé pourraient renoncer à leurs avantages. Cela aurait pour effet de déstabiliser le marché des avantages et d'accroître le coût actuel des avantages. Par ailleurs, qu'adviendrait-il des patients qui ont un problème de santé préexistant? L'approche actuelle en matière de politique publique fonctionne comme prévu. Les professionnels de la santé aujourd'hui réunis sont préoccupés par l'accès des Canadiens aux soins. Retirer l'accès aux soins à des millions de Canadiens n'est certainement pas le moyen de régler les questions de justice et équité. En fin de compte, une telle décision ne simplifie pas le code des impôts actuels et n'importe pas plus d'équité à la population canadienne. Elle rejettera le fardeau sur les employeurs et privera de nombreuses personnes des soins dont elles ont besoin. Merci.
Good morning. I'm Dr. Karen Cohen, the Chief Executive Officer of the Canadian Psychological Association, or CPA, also a member organization of HEAL. There are approximately 18,000 psychologists licensed in Canada. We are Canada's largest group of regulated and specialized mental health providers, delivering psychological treatments to the millions of Canadians who live with mental disorders in their lifetimes. Because of public sector constraints, psychologists increasingly work in the private sector, where their services are not covered by public health insurance. Those services are either paid out of pocket by Canadians or through supplemental health insurance plans. CPA applauds the federal government's commitment to mental health. We hope that the federal and provincial and territorial governments will go back to the table and make meaningful change to how Canada provides mental health services within our public health systems. Without any change, however, our grave concern is that a reported federal government proposal to tax premiums on supplemental health insurance will make these services less rather than more available to Canadians who need them. Taxing premiums brings a range of consequences. When health and dental premiums are taxed, the number of employers offering insurance decreases. Younger and healthier employees given the choice may opt out of participating. With older and sicker employees opting in, premiums will rise. Employers who continue to offer these plans may reduce coverage to control costs. This will be keenly felt by people with mental health problems because coverage limits for psychological services are often already too low to cover the amount of service needed to treat most problems. Mental disorders cost the workplace and the Canadian economy tens of billions of dollars annually. We need to give incentives to employers to take care of the mental health of their employees. Legislation which will lead to less coverage for more Canadians is not the way to do it. Thank you. Merci. S'il y en a des questions, on peut les prendre.
I have a question for the Dentists Association. Could you explain how exactly this will affect dentists kind of on the front lines of things?
Dental care is private, and the insurance industry, through the products that they offer, help enormously to help workers who are in those areas to have dental coverage. And if those benefits are taxed, the pool of people who will be in that will be reduced, and people will be less likely to use those services, resulting in increased dental problems, many of which could spill over into the public health care system. So the cost to Canadians broadly will only go up if this goes through.
The policy measures that they're talking about, did this take you guys by surprise? Did you have any contact with finance beforehand about this, or did you learn about it through media?
I think that this kind of discussion of taxation of benefits has occurred before, and I don't think that this is a good time to be considering any changes given what's broadly happening with the discussion on health care across Canada. We have a system that works, and I think that on balance, it's the best offer that we have at the moment, unless there's some new plan or new broad concepts that can balance the disparate elements that we're dealing with. This is the best way forward for Canadians.
Why do you think the government wants to go ahead with the taxation, or why it's looking at taxing health benefits?
I think the government is looking at all ways that revenue can be increased. And I think that it's reasonable to take a close look at every element. But I think when you look at this particular one, you see that the negative consequences outweigh the benefits. And so this isn't an area that would be of benefit to Canadians broadly.
Do you know how many Canadians this would affect in total?
Well, I think that 75% of Canadians have access to health benefits through this plan that is currently in existence, and it would affect those people. We talk about the incentive for using health care. At the moment, I think the cost that the government is considering as being a benefit to them would be an increase in $2.8 or $2.9 billion in increased tax revenue. But the incentive for people to use the services is in the area of $32 million of benefits that $32 billion that they're receiving. So there's a tremendous incentive to maintain the existing system because it's much better for so many Canadians who are going to have improved health through this system. You only have to consider what aspects of healthcare are going to be an incentive for people to want better health and to be able to access the care that they need. So whether it's someone with a musculoskeletal problem, a psychological problem, a dental problem, whatever the problem is, the current system is helping them enormously to seek the care and to be able to receive that care. If you make it harder for them to access that care, then it's going to have consequences that will be felt throughout Canada in the workplace and through the cost of health care broadly across Canada.
Have these things ever been taxed before federally? I understand there's a case in Quebec, but I'm just curious.
I don't think so.
Yeah, that's all I have to ask. If anyone has to add.
Thank you.
Thank you.